Hi everyone, welcome back to my YouTube channel. Today we are going to talk about frontal bone. And here at the side you can see the diagrammatic representation of skull and the green portion of it is frontal bone. So let's start the topic with introduction. Frontal bone is located at the front of skull and plays a central role in protecting the brain's frontal lobe. In addition to its protective function, it contributes to the structure of orbit and sports several key features. Given its prominent location, the frontal bone is often involved in both developmental process and clinical conditions. Understanding its morphology and significance is essential for students of anatomy, medical practitioners, and research involved in craniofacial studies. Now let's talk about location and shape of frontal bone. Frontal bone forms the forehead and extends laterally to form a part of orbital cavity. It is a large unpaired bone that arches over the orbit, combining convexity with planarity to create a smooth forehead contour. Its location at the front of skull makes it a key component in protective structure of brain as well as defining facial aesthetics. Now let's talk about surface feature of frontal bone. Frontal bone exhibits several notable landmarks. The first is supraorbital margin, as this raised border forms the superior rim of orbital cavity and provides attachment points for muscles and ligaments. It is clinically significant in both aesthetic evaluation and reconstructive procedures. The second surface feature is glabella. That is smooth area situated between the superciliary arches is known as glabella. This region is not only of cosmetic interest but also serves as a reference point in anthropological studies. Further talking about surface feature, it has frontal sinuses that are present within the body of frontal bone and they are paired air-filled cavities that are called frontal sinuses, whose sizes and shape can vary considerably among individuals. These sinuses contribute to the weight reduction of skull and play a role in resonance and air filtration. Next feature is coronal suture. That is the frontal bone articulates with the parietal bone and their suture with the frontal and parietal bone is called as coronal suture. Precise alignment of these sutures is important during cranial development and in surgical reconstruction of skull. Now let's talk about development and ossification of frontal bone. First we will talk about embryological formation. The development of frontal bone begins during early embryogenesis. It forms through a process known as intramembranous ossification, where mesenchymal tissue directly transforms into bone without a preceding cartilage stage. This method of ossification is critical in forming many of the flat bones of skull. Then there is postnatal growth of frontal bone. As during childhood, the frontal bone undergoes a significant growth to accommodate the expanding brain. These sutures between the frontal and adjacent bones, especially the coronal suture with the parietal bone, remain open to facilitate this growth. This eventual fusion of these sutures marks the end of significant cranial expansion and is in developmental biology and periodic craniofacial morphology. It is very important and it's an important indicator. Now let's talk about significance of frontal bone. The first significance is its protective role. As a key component of neurocranium, the frontal bone plays a primary role in safeguarding the frontal lobes of brain. Its robust structure and strategic placement help absorb impact and protect against injury that might otherwise compromise brain function. Second significance is its contribution to facial aesthetics. As it is beyond its protective function, but the frontal bone also contributes significantly to aesthetic appearance of human face. Its curvature, the prominence of supraorbital margin, and the layout of frontal sinuses all influence facial expression, symmetry, and overall impression of appearance. Anthropologists and forensic scientists often analyze the frontal bone for clues about age, sex, and even ancestry. Further talking about significance, it has role in airway and sinus function. As the frontal sinuses located within the frontal bone have several functional aspects, they help lighten the weight of skull, contribute to voice resonance, and participate in humidifying and filtering incoming air. Variation or infection in the frontal sinuses can affect these functions and lead to clinical concerns such as sinusitis. Now let's talk about clinical significance of frontal bone. The first is traumatic injuries. As due to its exposed position, the frontal bone is frequently subject to trauma. Fractures in this bone can have significant consequences, potentially affecting both underlying brain tissue and the integrity of frontal sinus system. Precise imaging using modalities like computed tomography is critical for assessing the extent of damage and planning surgical intervention. Next clinical significance is surgical consideration. As computer-aided surgical planning often relies on detailed anatomical knowledge of the frontal bone. Surgeons, especially those specializing in neurosurgery and maxillofacial reconstruction, must navigate the complexities of bone shape, the location of suture, and presence of frontal sinuses. In corrective or reconstructive procedures, maintaining or restoring the natural contours of frontal bone is paramount for both functional and cosmetic outcomes. And it also has pathological importance as diagnosing pathological condition, as apart from trauma, various pathological conditions such as frontal bone osteomyelitis, tumors, or congenital malformation can complicate this region. One common clinical scenario is the involvement of frontal sinus in infection, which might extend into the adjacent bone or even intracranially. Understanding the detailed anatomy of frontal bone aids in health professionals in diagnosing and managing these conditions effectively. Further talking about clinical significance, it also has significance in imaging and diagnostic category. Modern imaging techniques such as CT scan or computed tomography, magnetic resonance imaging or MRI, and plain radiography provides detailed view of frontal bone. These images help identify fracture, evaluate sinus health, and plan surgical approach. Radiologists often use landmark of frontal bone such as supraorbital margin and frontal sinus configuration as a reference point in diagnostic assessments. Now let's talk about conclusion of whole this lecture video. Frontal bone is multifunctional component of human skull. Its contribution range from protecting the brain and shaping facial aesthetic to playing role in respiratory and sinus function. A thorough understanding of its anatomy, development, and clinical significance is indispensable in diverse fields such as neurosurgery, maxillofacial surgery, forensic anthropology, and radiology. So this was all about frontal bone, and hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.